So I wanted to talk to you about your book Humans 2.0 that you put out. I have it right here. I read it probably a little over a year ago now. And it's an intriguing book about a topic that I understand very little about. And so I wanted to have you on to sort of explain what transhumanism is and some of the implications for mankind. So, with that being said, can you give us sort of an overview of what transhumanism is?
Sure. And in my experience, many people don't know what that term means,
Mm-hmm.
but yet they are familiar with the concepts that undergird transhumanism. And in a nutshell, transhumanism is this idea that we should use technology to essentially modify our biological makeup with the idea of making humans improved, right? That this would help us to, overcome our biological limitations, overcome our biological flaws. And many transhumanists argue it's these limitations, these flaws that create a lot of pain and suffering in humanity. And if we could correct them with technology, we could mitigate pain and suffering and use science and technology as a way to move us closer to a utopian type of future. And in fact, many transhumanists argue that the ultimate source of our pain and suffering is our own mortality, and that maybe transhumanism could help us attain extended life expectancy, pushing us towards a practical type of immortality. Now, this idea has been around since the turn of the last century. I think it was J.B.S. Haldane in his book, The Atlas, who first expressed this idea of transhumanist thinking. And Haldane's book, The Atlas, was the inspiration for Huxley's book, A Brave New World. But this idea has been around, but it's always been considered kind of a fringe idea that nobody really took seriously until about a decade ago, where suddenly this idea has been propelled into the mainstream. And it's because we now have the technology available to us through gene editing and through computer brain interfaces, as well as advances that are happening in anti-aging, that essentially give credibility to this transhumanist agenda and suddenly has made it respectable, not only in the academy, but it's now beginning to really infiltrate our culture. There's a US transhumanist party, and every state in the United States has a transhumanist party in that state, where transhumanists are working to actually advance their agenda through political persuasion. And so this is an idea that permeates our culture. It's the fodder of science fiction, and now suddenly it's become a reality before our very eyes.
It does really sound like science fiction. A lot of the terms and things just sound like something that you don't hear in day-to-day life unless you're watching a science fiction movie. So, can you sort of explain what is gene editing? What is the computer brain interfacing? What are these terms? What do they mean?
Yeah, yeah. Well, as the name implies, with gene editing, it's essentially modifying our genetic information through the use of genetic engineering techniques. And it's long been the dream of many biomedical practitioners and researchers to have the capability of correcting genetic disorders that take place because of mutations in our genome. And in fact, there are 5 to 10,000 genetic diseases that involve a single mutation in a single region of the genome. And many of these genetic diseases are rare. They don't have effective therapies or treatments available to them. There's no way that we can cure genetic disorders currently. And so the thought is, could we use technology to go in and to replace the defective region of our genome with a healthy version of that genome? That would be gene editing, where it would be like cutting and pasting in a Word document. In effect, if there's a typo in a Word document, if you could do cut and paste, you could essentially correct that error. And that's essentially the idea behind gene editing, where the information that you're manipulating is harbored in the DNA molecule. And this idea of doing gene therapy has been around since the 1970s, and nobody could get it to work. And in the last, maybe about 10 years ago, there was the discovery of the CRISPR-Cas9 system in bacteria, which is essentially a system that the bacteria use to protect itself from viral invasions. And two researchers at Stanford University realized that they could actually utilize that system to develop a gene editing process that is highly targeted, highly efficient, and highly ineffective, highly efficient, highly targeted, and easy to use and inexpensive. And as a result of that, you have a revolution now happening in gene editing, where people are looking at progressing this technology into the clinical stages, where people are using it successfully in small-scale clinical studies to treat people with blood disorders, and are looking to progress it beyond that point. So the idea here is that once you can change or alter our genome to correct a genetic defect, who's to say you couldn't go in and create a designer human being, where you could now manipulate the genome to create desired properties? Or could you even manipulate the genome in such a way that you would enhance our capabilities beyond our natural biological limits, making us stronger, more intelligent, living longer, those types of things, more psychologically well adjusted, and so this gives credibility again to the transhumanist vision. This is what transhumanism is all about, is enhancing human beings. Brain-computer interfaces, this is an area of bioengineering. It's on the other end of the spectrum, if you will, where engineers are developing these electronic devices that can be implanted in the brain that can detect electrical activity from the patient's brain, the subject's brain, and that subject can either learn to control their electrical activity in the brain, to manipulate hardware and software that's interfaced to the brain-computer interface, or the brain-computer interface through machine learning can learn to interpret the user's intent, the subject's intent, and as a result of that, again, can manipulate computer hardware and computer software. And so this is going to revolutionize how we treat patients that are locked in because of a brain injury and they can't communicate. This is going to revolutionize the treatment of people that are amputees, because they can learn to control robotic prosthetic limbs. And there's been a lot of work showing a lot real interesting progress for people that are quadriplegic or paraplegic. This technology could be used to allow them to control exoskeletons that give them mobility, and the list goes on and on. And again, so this is an incredibly exciting stuff, where the patient is able to control computer hardware and software with their thoughts, with the electrical activity in their brain. But you could also, at the same time, use that same technology now to create really human-machine hybrids, cyborgs, if you will, that have enhanced biological capabilities. And again, this gives legitimacy to transhumanism. And for many people, they think that if we're able to really, with our thoughts, begin to control computer hardware and software, it's just a matter of time before we're going to be able to upload memories, into a machine framework. And once you can start doing that, could it be possible to actually, attain a digital type of immortality? So those are the types of technologies that are taking place. And the common theme is you have these incredible advances that can revolutionize medicine, but at the same time can be used to enhance human beings beyond our natural limits. And this gives legitimacy to transhumanism. And part of what's going on here is the cost of these technologies is and the ease of use of these technologies is becoming accessible so that they could be implemented on more or less a wide-scale basis.
So I think I understand the brain-computer interface. And I'm assuming, and we'll get to it in a second after my first question, I'm assuming that that is where they would implant some sort of device on your brain and you'd be able to interface with computers externally. What I don't understand is the process for the gene editing. Is that some sort of surgical process that would occur? How would that actually happen?
Well, I mean, it would be a process that would be very similar to what you see with the J&J vaccine.
Hmm.
The J&J vaccine is an adenovirus vector vaccine. And so what you're doing with that vaccine is, or what the researchers have done, is they incorporated the gene for the SARS-2 coronavirus protein into the adenovirus vector. They've also genetically manipulated it so that it can't reproduce inside the cell. It can't incorporate its DNA into the cell. And so it now becomes essentially a gene delivery vector. That's what the J&J vaccine is. It's a gene delivery vector that carries the spike protein gene into cells in our body, directing our cells to make the spike protein, presenting it to the immune system, and our immune system recognizes it as a foreign material and generates the immune response that leads to acquired immunity. And so, for example, people have used that same approach to deliver the gene that codes for a protein that is not produced or is produced as a mutant protein in Tay-Sachs disease, which is a disease that leads to essentially a very short life for a child, and they become, in a sense, a vegetable within a few months of birth because they lack certain functioning genes that produce proteins that lead to the turnover of certain molecules that are in the cell membranes of neurons. So it's a devastating disease. And there's been a breakthrough in terms of treating that by using this adenovirus type. Well, it's not exactly the adenovirus vector. It's something called the adeno-associated virus as a vector to carry in the gene for the healthy version of that protein. And by delivering it to key regions in the brain of these patients, essentially injecting it in where the adenovirus vector will carry the gene into the cells, into the neural cells, you can actually reverse the symptom, not only arrest the Tay-Sachs disease, but you can actually reverse the disease. And so that's the type of technology, is that you'd have some kind of delivery mechanism. Now, one way to do this is to simply deliver the gene incorporated into a virus. Another approach would be to use that viral vector as a way to deliver what we would call the gene editing package, the CRISPR gene editing package, which is a collection of enzymes and RNA molecules that, once inside the cell, would essentially chop out the defective region and replace it with a healthy version. So it's essentially the technology we see with these messenger RNA vaccines and of Pfizer BioNTech and Moderna, and the J&J vaccine with the adenovirus vector, is the technology that will readily translate into advances in this gene editing. So the development of these vaccines is really critical, not only in terms of revolutionizing infectious disease treatments, but actually is going to revolutionize medicine in a broader sense because of their use in gene editing.
So is it pharmaceutical companies that are really on the front lines of the gene editing technologies?
It's both pharmaceutical companies and really, more broadly speaking, biotechnology companies. But also you see a lot of people funded by the National Institutes of Health or the National Science Foundation as university researchers that are also exploring this technology. The thing about the CRISPR gene editing technique is it's a relatively easy technique to use. Unlike the adenovirus vectors or the adeno-associated virus vectors, CRISPR gene editing is much easier to use, and it's much less expensive. It's much more robust. And so it doesn't take a lot of money or expertise to set up a laboratory where you are exploring gene editing applications with this technology, which is great because it allows you to progress it into a clinical setting at a relatively low cost, which is going to be critical if it's going to have widespread use. So, we are, on the cusp of I think, a revolution in biomedicine because of this CRISPR gene editing technology.
So besides the J&J vaccine, are people right now using this technology, or is it still in the research phase?
It's still in the research phase. There's a lot of technical issues that still need to be resolved, but there have been some small scale clinical trials that have shown success. So for example, I'm drawing a blank on the particular blood disorder right now that has been treated in clinicals, but the idea would be, let's say, just for sake of discussion, somebody suffers from sickle cell anemia. And that's a single mutation in one of the genes that codes for one of the subunits of hemoglobin. And because of that mutation, the hemoglobin forms it clumps together in the cell, causing the blood vessel to sickle, to form a kind of a sickle shape. And that gets clogged in the capillaries, and it's just a mess, right? So the idea would be, if we could go in and replace that defective hemoglobin gene for the hemoglobin subunit with a healthy version, we could treat that patient suffering from sickle cell anemia. And so the idea is that because it's a blood disorder, we can actually take stem cells from bone marrow, the hematopoietic stem cells that develop into the different blood cells, take them into the laboratory, do gene editing on those to replace the defective gene with a healthy version, and then reinfuse the gene edited hematopoietic stem cells back into the patient's bone marrow. And now they're going to produce healthy versions of red blood cells. And so you may not have cured the patient of sickle cell anemia. You probably would have to repeat this procedure multiple times throughout the course of their lifetime. But for a significant period of time, you've essentially eliminated the symptoms that they were going to suffer. Again, while you're not really curing it, it's a leap forward in terms of treating the disorder. So for blood disorders, this technology is going to work really well because you can do the gene manipulation, ex vivo in a laboratory setting. Now, the next challenge would be if for patients that, let's say, have other types of genetic mutations where you don't have that, access to cells directly like that. But you could protect it for, like, let's say somebody suffering from, good grief, this happens when you start to get old, you can't remember things. But it's essentially a disease that involves a mutation in the chloride transporter. I'll remember the disease, but it's essentially impacting lung cells. And so you could develop aerosols, for example, that could potentially deliver the gene editing package. And the thing is, you don't have to do effective gene editing on every one of the cells in the tissue. If it's just a certain percentage that are effectively gene edited, that is going to be enough to dramatically improve the symptoms of the genetic disease. Ultimately, though, people are going to want to have ways to target particular cell types with the gene editing packages. And this is where, certain viral vectors can become useful because, for example, with the SARS-2 coronavirus, we know that virus gains entry into cells by binding to what's called the ACE2 protein on the cell surface. And so any cell that has an ACE2 protein can have essentially the SARS-2 coronavirus invade that cell. So likewise, we could say if we want to target, let's say, a gene editing to, cells in the heart, like, to cardiocytes, let's say, we could actually, develop a viral vector that would bind only to a particular surface protein found on cells in the heart, muscle cells in the heart. So that would be an example of how you could begin to do targeted delivery, where you would just infuse the the viral vector into the patient's bloodstream. So, the technical the strategy to do this is well understood. Can we actually technically do it would be another question. But again, what we see with the COVID-19 vaccines, to me, is a significant step forward in actually advancing gene editing.
It's all really interesting. And I do want to get into the other parts of transhumanism, even though I do have probably 2 million more questions on gene editing. But I want to get into the brain computer interfacing. And so, from what I understand, how it works is they do implant some sort of device onto your brain that picks up the signals given off by your brain, and that would translate into some sort of computer system. So is it only able to be used in a diagnostic way and for prosthetics, or can it go beyond that and allow you to control, I don't know, random things like production in a production facility, or a computer program like Microsoft Word or something like that?
Yeah, well, there's a lot of progress taking place in brain-computer interface technology, and it's happening at a breakneck pace. And right now, most of the applications involve controlling, like, let's say, a prosthetic robotic limb with gross motor movements. That fine-tuned movements still aren't really quite possible. But recently there was a breakthrough in converting electrical activity in the brain into actual text. And it was essentially using machine learning to interpret the electrical activity in the brain as the patient imagined writing different letters in the alphabet. And they could even incorporate punctuation and things like that. And they could actually, through just their thoughts, convert thoughts into text at a pace that was equivalent. It was about the same rate as it would take for you or I to type a text message on an iPhone. And it was about 90 letters per minute. And so this is a significant breakthrough that, should in the future set the stage for maybe, patients communicating in a much more rapid, manner. And of course, because computers also have, text to voice or text to sound applications, you could envision the patient actually being able to speak. What's also interesting about the brain-computer interfaces is that the flow of information is both ways. It's not just the patient communicating intention to machines or computer software, but machines can actually send electrical signals to the brain that the brain can learn to interpret as information. And so it's actually setting up potentially a two-way mode of communication. And so you also, because of Bluetooth technology and the capacity of the internet, there have been studies where somebody in one location has been able to actually activate robotic limbs in a remote location on the other side of the world. And so you now are able to affect actions outside your immediate sphere of influence, and there's even thought that you might be able to tether people's brains together, where people could communicate thoughts to one another through brain-computer interfaces. Now, this is still a way away, but the idea is that if it's a two-way flow of information, then what I'm thinking should be able to impact, what you're thinking, or I should be able to communicate thoughts to you through these, if we both have a brain-computer interface and we're tethered together through Bluetooth technology and through the internet. And so this is something that is not that far away in the future of being able to be achieved. And for example, Elon Musk has formed a company called Neuralink, and he's made some significant improvements in quality of brain-computer interface technology. And he believes that this is going to be the next generation of user interfaces with electronic devices, where we would be using, instead of voice commands, we would be using thought commands. Elon Musk is interesting because his motivation ultimately for forming Neuralink and trying to advance brain-computer interface technology is his fear of artificial intelligence and AI systems, because he believes that AI systems are going to eventually outpace human capability. And when that happens, they're going to rule over us, as opposed to the AI systems being our tools that we would use. And so he argues that we've got to be able to build these brain-computer interfaces so we can augment our intellectual capabilities by interfacing our brains with computer systems, so that we could actually compete as cyborgs with the AI systems that we would create. And so again, you can begin to see this idea of transhumanism really, infusing Elon Musk's thinking, where the idea is that, we can take control of our own evolution with this technology and really create human beings that are so heavily modified by technology that what we create would not be recognizable by us as actually human beings, that we could usher in effect, a post-human future where the entities that exist, that come from us, would be essentially post-human types of species, and maybe a collection of them based on the technology.
I gotta admit, Dr. Anna, this all sounds a bit scary to me. And I do gotta say, I feel the brain tethering also makes me a bit nervous. I feel as if husbands all around the world are shuddering thinking about their brains being tethered to their wives when they're asked if their outfit makes them look fat. Every husband is in trouble of this technology. But with that being said, maybe it's my conspiratorial side that's thinking of this, but do you think this technology, since you said that it can go in the opposite direction, do you think that there would be a possibility of it being used maliciously to control people?
Well, this is your question really brings up a larger concern. And that is that, in effect, what you see with transhumanism is an idea that is undergirded in science and technology, where the ultimate goal is for science and technology to improve our lives, which I think nobody is really uncomfortable with. That has been the function of science and technology since the inception of these human activities. But the concern is that ultimately people are turning to science and technology as a mode for our salvation, to create a utopian future, to help us escape our immortality, to help us to escape, our limitations as human beings. And you're assuming in all of this, rather naively, that the human beings are not going to use the technology in malicious ways. And as Christians, one of our contributions to the conversations about how the technology should be developed, how should it be used, is to remind people that human beings are sinful, that we have this ability to take even the best of inventions and use them for horrific purposes. And the more powerful the technology, the more horrific the outcome could be if used, maliciously. And so this is a very real concern, is that if anything, the transhumanist vision is extremely naive in terms of thinking that the technology won't be misused. And part of the concern I have is that the technology is very easy to use, it's inexpensive, it's broadly accessible. And so you have, for example, grinders, which are people that aren't necessarily the scientific and technological elite, but are just average people who want to use technology to modify their biological makeup. and they feel as if they have a right to do that. You also see something called the biology DIY movement, do it yourself, where, for example, a biochemist by the name of Josiah Zahner has argued that this technology is so revolutionary that it should be democratized, that it shouldn't be in the hands of the scientific and biomedical elites. This, and here he's referring to gene editing, but it should be something that everybody should have access to, and that we should be able to genetically modify ourselves at our own whim, at our own, based on our own desires, and that nobody should tell us what we can or can't do with our bodies. The problem with this is that this is not just simply, an active imagination. This is something that is a reality. You can go on Amazon, and the last time I looked, for under $200, buy a CRISPR gene editing kit that you can have delivered to your house. Now, this is a relatively, simple gene editing experiment that you do that is harmless and more fun and more of a novelty. But if you're willing to invest several $1,000s, you can get much more sophisticated gene editing kits that allow you to do interesting things, and potentially you could administer a gene editing, package to yourself, and who knows what could happen as a result of that. But the point is that this technology is so easy to use, so inexpensive, so widely accessible, that it really lends itself to abuse, to unregulated, uncontrolled activities. And right now, it's, again, the technology hasn't progressed to the point where I expect anything nefarious to happen. But in a decade or two, we very well may be looking at sophisticated technology that really would create kind of like a wild, wild west of human enhancements, where anything goes, and this again is a reality that isn't, out of bounds.
So I want to hear more about these Amazon CRISPR kits. Are these like kits that you can order in the mail and you have to inject yourself with?
No, these are things where you're doing the gene editing on probably yeast or some kind of E. coli or something like that, probably brewer's yeast or something like that, where you gene edit the yeast and you introduce, let's say, a gene that codes for the green fluorescent protein, and now the yeast will fluoresce green or something like that. But the point is that it's the same technology that's being used there that would be used to treat somebody with cystic fibrosis or sickle cell anemia.
I see. That makes a lot more sense. So I do want to talk about another potential moral implication for this, and that is the designer babies that I believe you mentioned in your book. What is that, and how can that be attained? Would they have to be genetically modified in the womb?
Yeah, to create designer babies or to do gene editing in such a way that you would actually cure the patient of a genetic disorder, you have to actually do the gene editing at the single cell stage in the embryo. We've learned that you have to do the gene editing concurrent with the process of fertilization in order for you to effectively alter the genetic makeup of every cell that results from that particular zygote. So you would have to do it at the very early stages. And so the idea would be that, let's say we have identified 2 or 3 genes that are responsible for height, just as an example. Then if the parents say, I want to have a child that is tall because I want to have a child that has a chance of playing in the NBA, then you would actually those parents would do an in vitro fertilization process where the CRISPR gene editing package would be delivered concomitant with the sperm and the egg combining, and that would alter those particular genes so that the version of those genes that controls height would be replaced, that would naturally occur in that embryo would be replaced with the genes that you would deliver to the embryo. And so that would be an example of creating designer babies, where you would, manipulate the genetic makeup of the baby at that single cell stage, and of course, this is involving manipulation of human embryos. And, there is there is about a 72% efficiency at best for the delivery of the gene editing packages. So you'd have to probably do this for a number of embryos and then screen those to make sure that the ones that you select were effectively gene edited and there weren't anything like off-target effects and stuff like that, that are one of the technical complications. So you're essentially involved in vitro fertilization, screening, and then selecting embryos where the other embryos would be destroyed because they would have they would not be healthy embryos because of what you had done to them with the gene editing and the failure of the gene editing process. So it's not 100% guaranteed. There is some failure that we're still beginning to understand what causes it and how to mitigate that. But so that leads to all kinds of, very troubling pro-life implications, obviously. But this is the type of idea that undergirds designer babies. And of course, it's only a stepping stone from creating human beings at that stage to that procedure that are enhanced beyond our natural biological limits that, let's say, would be stronger or would be more intelligent or, what have you.
So I think I understand the argument against having designer babies from a Christian standpoint, right? So God creates us, we're messing with God's plan and his design. But of course, as we know, I'm sure you dialogue with atheists and non-believers constantly, as do I, that we don't really have the ability to use the Bible as an authority in these conversations because they don't see it as an authority. So what would be the moral argument against designer babies if I wasn't using God as a moral argument against it?
Yeah, well, I mean, to me, I think one argument you could make it would be that any kind of genetic manipulation you do in an embryo is going to be passed on to the subsequent generation if that embryo reproduces. And once that happens, then you're introducing genes into the human gene pool that we don't really understand or we don't really know what their effect would be. And this could actually lead to potentially our extinction as a species. And so this is the primary argument that I see from secular bioethicists against doing gene editing for the purposes of designer babies or for the purposes of human enhancements. So that would be the secular, the secular argument. But that really, leads to, I think, a broader critique of transhumanism. And that's the idea that with technology, there's always unintended consequences. That there's always, that technology can be wonderful in terms of solving a problem, but many times because of unintended consequences, the problems that you solve are outstripped by the new problems that you have created. And so technology always disappoints us in many respects. It's never, there's always a double-edged sword where technology, mitigates pain and suffering, but causes new sources of pain and suffering many times. That's our history with technology. And so this is, something that, technologists recognize. This is something that philosophers of technology almost universally agree upon. And so to me, the critique of transhumanism would be essentially looking at the history and the philosophy of technology and just reminding people that, many times, what we think is going to be a good thing winds up having, again, these unintended byproducts that may well introduce more pain and suffering into the equation than actually existed to begin with. It's just that that pain and suffering is of a different nature or of a different character.
Do you think there could also be socioeconomic implications with these designer babies, such as like only rich people can afford certain types of gene edits and it's not accessible for everyone else? So there's going to be sort of a superior group of people that come out of gene editing. Do you think that's a possibility as well?
Yes, that is a very real possibility, and that would be another ethical concern that is raised by both theistic ethicists as well as secular ethicists, which is essentially creating a world of haves and have-nots. And we already see disparity when it comes to access to medical treatments, and where those people that are well-to-do tend to get the best medical care, and those people that are not don't. And with technology like this, you can only see that disparity becoming exacerbated. And once you grant certain advantages to people, that then snowballs. It builds on itself, where they are able to leverage that advantage into even a greater advantage. So that is a very real concern, is really the inequity of this technology, and what that would mean, if people were able to, only certain people were able to receive enhancements and other people weren't.
Yeah, I can only imagine some of the civil unrest that would be caused because of a certain group of people having genetic advantages from birth. They have advantages over just regular people, and how a whole new class system would arise because of this. Um, so really interesting stuff. And like I said earlier, I wish we had all day to talk about this, because it's such an interesting topic and really revolutionary to humankind.
Yeah.
Um, so for anybody who's interested in this topic and the work that you've put out for this topic, where can they find out more about you and the work that you've put out?
Well, the best place to go would be to reasons.org, and you can get a copy of Humans 2.0. But I also have a blog called The Cell's Design, where I write about a number of different areas of the life sciences and what it means for the Christian faith. But I routinely have articles on advances in transhumanist technology, and again, and interact with these advances from a Christian worldview perspective. But to me, the thing that's exciting about transhumanism is that I believe it really represents an opportunity for us to introduce the gospel into our world today with a sense of urgency and relevancy unlike any time before. Because ultimately, what transhumanists are seeking after is salvation. And if we can show them that technology can never save us, and that really true salvation is in the person of Christ, we have an opportunity, I think, to win people over. But what's interesting to me is that transhumanism is really lending itself to really profound theological questions about what is my meaning and purpose? Do I actually have hope, purpose, and destiny? And how do I ultimately attain eternal life? And that's a great way to introduce people to the gospel.
Yeah. It sounds like there's some very interesting conversations that are going to pop up in the next 10 years. So, Dr. Rana, I appreciate you explaining this difficult topic to us. Very interesting conversation. Thank you so much for being on the show with me today.
Ryan, thanks for having me. It was a lot of fun.